Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Recent advances in rheumatoid arthritis. In rheumatoid arthritis, we have newer drugs like Etodolac. Etodolac is a chiral NSAID. And this Etodolac is a chiral NSAID which is used in the treatment of rheumatoid arthritis. Then we have Licofelone. Licofelone is a dual inhibitors. Licofelone is a dual inhibitors and this will block the cyclooxygenase therapy and it will also block the lipooxygenase therapy. Actually, it will block the cyclooxygenase and lipooxygenase pathways of arachidonic acid. Okay, so this Licofelone will block is a dual inhibitor. It blocks both cyclooxygenase and the lipooxygenase pathway of arachidonic acid. So it is an analgesic. Sorry, not an yeah. It is an analgesic. It is pain relieving. It is anti-inflammatory effect, and it also has an anti-asthmatical effects are present. So these are Licofelone. Then the newer drug we have Flupirtine. This Flupirtine is a selective neuronal potassium channel opener and this acts on NMDA receptor. This has NMDA receptor antagonist properties. Okay, this Flupirtine is a non-opioid. It is a non-opioid, non-NSAID, non-steroidal drug and it is used as an analgesic. Then the next drug is Sarilumab. What is the Sarilumab? It is an anti-interleukin 6 monoclonal antibody. It is used in rheumatoid arthritis.
thank you and thank you for watching.